Good morning, everybody. It is 8:39 right now. Welcome back to Iowa Live. Lou and Jackie here.
Good morning.
Being joined by a good friend of ours, Dr. Jennifer Welch from the Iowa Functional Health. And we're talking about peripheral neuropathy here this morning. And what you're saying to yourself is, what is that?
That's what I've been saying.
Yeah.
I'm just trying to learn how to say it still this morning. But it has to do with pain.
Yes.
So if we can educate our viewers this morning on what it is and how there might be some treatments out there for them, we'd appreciate that so much. So let's talk about it. What is peripheral neuropathy?
Sure.
Good job,
That was
Jackie.
kind of.
You
I
got it.
struggled,
You
but I got
I think she got it, yeah. Peripheral neuropathy is nerve pathology outside the brain and spinal cord. So the peripheral part means outside brain and spinal cord. So it affects most commonly it affects your legs down to your feet. It can also affect your arms into your hands. And so it is a very common nerve pain condition. Although pain isn't its only symptom, it affects millions of Americans, and it's one of the top causes for doctor visits.
Now, you say affects.
Really?
How is it affecting people?
So let's just kind of cover some of the symptoms. The symptoms can vary, as I said, from pain, that's very common, numbness, tingling, feels like your hand or your leg fell asleep, can make you weak. I had neuropathy myself, my arm was affected, and so my symptoms were pain, but it would change. It was a pain like I'd never had before. My hand would fall asleep at random times. Just shaking someone's hand would be painful.
Wow.
I was going to say, because how can you tell the difference? Because I have a tendon in my arm that likes to act up, so it causes me some pain in my fingers. How do I know, besides obviously visiting a doctor and having a good relationship there, how do I know that it's going more towards what you're talking about with nerves that are kind of breaking down as opposed to something else?
Sure. I mean, so over time, overuse is one type of cause of peripheral neuropathy, so like tendonitis, carpal tunnel, those can cause peripheral
They're all
neuropathy
connected.
symptoms. Yeah, they are connected.
Okay.
But when the symptoms persist, that nerve is being damaged. And so like burning, tingling, numbness, weakness. Some patients tell me when they feel like they're wearing a sock, which they're not really wearing a sock. So they just have that weird sensation, or that they're stepping on a tissue or something under their foot when there's nothing there.
Yeah, I've heard of a situation where people had like the side of their leg feels like it's numb. Would that be a condition too that could be?
Could be, yeah.
Could be related.
Could be related to that. So the symptoms can vary. Sometimes shooting pains, and I had that sometimes myself, where I'd like go to shake someone's hand, and then I just have this electric shock go down my arm.
Now, did you know the cause of what yours was? Because being a doctor, I'm sure you analyzed every possible.
I really did try, right?
Yeah.
I did try. There's lots of different causes. In my own case, I think some of it was a little bit structural. Some of it was like I was sleeping different and maybe doing some different things. Some of it was stress related. It came on for me at a very stressful time in my life. I was taking care of my kids. My husband traveled a lot at the time.
So stress can cause nerve damage?
Well, stress can set a cascade of events that'll make you predisposed to having other conditions, certainly.
And as you said, millions suffer from this.
They
and
do.
It's one of the big reasons that gets people to go to the doctor. So can the doctor, besides hopefully diagnosing it correctly, what can they do? What can we do to help alleviate? Because if you're talking pain and nerve endings, nothing about that sounds comfortable.
Right. So most commonly the typical treatment from a medical perspective is going to be pain management, medications, or surgery if it's a surgical indication. And I knew personally I didn't want pain medication.
Right.
That wasn't the right answer for me.
Right.
So I had to look in at what I knew from my background with neuro rehab or brain-based rehab. Your nerves need fuel and they need activation to thrive. Your body's very much a use it or lose it entity. So if you're stationary, things are going to fade.
Atrophy will set in and you're done.
Atrophy will set in. So we use technology now in my office. When I had my own neuropathy, I kind of reevaluated, what do I do for someone with neuropathy? And I embraced two technologies, came up with a system that really has worked. One technology has 21 white paper studies specific to neuropathy with positive outcomes. The other technology has been embraced by the Cancer Treatment Centers of America because chemotherapy is one potential cause for neuropathy. So they use one of the two pieces of equipment with their case devices. We embrace both. We get really positive outcomes.
So when I was gonna say, when you're talking
what is it?
technology and machines, what are you talking about?
Some therapies that people can do at home. So instead of having patients come to the office all the time for therapy, we give them the equipment that they do the therapy at home most of the time.
Now, is this equipment really expensive, or is this equipment that everyone can afford?
We try to make it affordable. It's not any more expensive, I would say, than most equipment devices out there that you're going to need, like a CPAP
Is
or
this
something
making
like
me
that.
do exercises, or what is this making me do so that it's actually causing some healing to happen?
The therapies are passive, so there's not a lot of active therapy. Now, I may, because of our conversation and my evaluation of you, give you exercises to do to help speed up your healing. But the two devices, they are passive. You sit back and relax. The therapy does itself in about 30 minutes. If you have both feet affected, we do both feet. You do the
So
therapy
what
at home.
happens? What happens with these machines? You're fascinating me now. You have these magical devices that you put your feet in, or they strap onto you. Or how do they work?
So one of them is a nerve stimulator, FDA
Okay,
approved.
sure.
Okay.
We've heard about those.
Okay, patented nerve stimulator. The guy that invented the ear thermometer. Have you ever had
Yeah,
your?
right,
Yep. He's an MD, PhD, smart, super smart guy. He invented the nerve stimulator for his dad, who had neuropathy, probably 15 or 20 years ago, and has now, embraced his technology and produced it for the masses.
Wow.
It has to be prescription based. So that's one of them. That's the stimulator. The other device is, there's a couple of different models, so it depends on what's being affected as to what I'm going to recommend, but is a light therapy, so photobiomodulation is the big keyword now. Speeds up healing, speeds up your mitochondria, which are your powerhouses in your cells, to make more ATP, which is your energy, so that you heal faster, wounds heal faster, pain reduction, lots of benefits from light
And you
therapy.
said there's a lot of studies that support some of this equipment that you're
Absolutely.
using. Too.
Yep.
And as you said, non-invasive, and you're not drugging yourself. You're actually doing something that's going to
Correct.
help you heal without just covering up the pain.
Yeah, we want to make the nerves regenerate, hopefully, or at least stop the progression of the condition. And so, yes, my main focus is to get your nerves to heal.
Yeah.
Now, how long did it take for yours to correct itself?
So I had neuropathy total for about 6 months. I went to other providers for a while trying to do their therapies. That probably was a good 3 months of that time. And then I did my own treatment on myself. And so 3 months or so.
And besides yourself, you've seen results using this type of therapy.
Yes, I've done it now for this, as I've described, this system for about a year in my practice, seeing probably 95% positive results.
Wow.
Yeah.
So, a game changer.
It is a game changer.
So what do you recommend if people you're describing that pain in the feet and the hands? What should be the first course of action that people take? Should they come find you? Do they need to talk to their doctor first and then come find you?
Yeah,
How
I would
does that
say
work?
most people have gone other providers before they come see me, so that's totally reasonable that people will go see their conventional doctor, their primary care doctor, what
Right.
have you. I'm usually the doctor of last resort, so it's totally reasonable for people to go elsewhere. I would say come to one of our seminars. We do a seminar pretty routinely. We only have capacity for 20 people in our seminar room, so if someone's out there wanting more information about neuropathy and if it's the right course of action for them, come to
Right.
one of our seminars.
Okay.
Where can we get information about the seminars?
Our seminar, you can call our seminar line. It's 515-599-0252.
Okay.
And then those calls are answered 6 days a week, not on Sundays, to get you registered for our seminar.
You see the number on the screen right there.
Yeah,
and
515-599-0252. And I bet you have a website as well that people can get more details.
I do. Iowa Functional Health is my main practice website.
Okay.
On that website should be a link to peripheral neuropathy, or I also have iowaperipheralneuropathy.com.
Okay.
So.
Dr. Jennifer Welch, thank you so much for being here.
Very
Thank
nice
you for
to meet you.
having
That's
me.
great information this morning.
Great.
And I love it. If you're helping people get rid of some pain, that's a good thing.
Absolutely.
8:49, and we will be right back.